Hello, this is Benji, and we're going to talk about everything prostate and intact today. Being intact that I've learned from my past few dogs, and just some wisdom I've acquired over the years. So, if you're thinking about keeping your dog intact, whether spayed or neutered, you probably are there because you've realized that maybe manipulating our dogs' bodies and excavating parts out of them that are key to the holistic health and well-being of them and the growth especially is maybe not the best thing. And when I was going through some of these experiences that I'll share with my other dog, his father, there was not much information out there. So I wanted to post this up and maybe it can help someone. Yes, so his father, his name was Boomer, and Boomer had a prostate infection from his litter with his mother. And he unfortunately passed away from the prostate infection. And even with that happening, it was one of the most traumatic experiences. Boomer and I had a very intimate bond. I would still never get any of my dogs neutered or spayed. And the reason is, well, I'll give a backstory. So Boomer was one of the healthiest dogs I've ever have known. He and I have been across the country 3 times together. We raised him on a raw food diet. He never knew a leash. The man was as free as could be. Truly was. We only put him on the leash in public when we needed to go into town or something of that nature. But he lived the dream. He lived the life of a king. The best life I've ever known for a dog. And that's what I wanted to do for him. He entered my life in an unexpected way. And from the dog before him, I learned that these dogs aren't meant to be inside. No dog's meant to be cooped up like a teddy bear on someone's bed all day. So my dedication was to make and allow him to be free as can be and try to live species appropriate. So when I had the litter, his mother was someone else's dog. The mother was not so healthy. She was younger. Boomer was only 7.5 when he passed, but she was like 3, and she had clear signs of a lot of dysbiosis and infections and a lot of itching of the ears that was excessive, leading to like squealing and whimpering and things like that. I didn't have any awareness at the time of it or even think about it. This was my first time mating. So I didn't even think how that could negatively impact him. But anyway, I had them get together and mate and so forth. And shortly after, Boomer did in fact get infected from mating. Now, there's not going to be a clear indication as to exactly the reasoning behind that, but common sense would connect it partly to the female and her current state. If she didn't have all these signs of unhealthiness and bacterial infections and so forth, then yeah, I mean, maybe that wouldn't even be a thought. But common sense would say that had something to do with it. So if you're gonna mate, check in on the health of the other dog. Check in on the health of your dog. Make sure your dog's good too. Anyway, so the prostate infections, the signs. So the signs started with him not being able to pass stool. And this was coming off of him eating a lot of bones, which he has usually done his whole life and never had a problem. So it's very unusual for him. But I thought, it's probably the bones. And it took a couple of days until I was like, all right, it's still not going. And I took him to the ER. We got an x-ray and we got an enema done and everything. And doctor said, yeah, it's the bones. It's a blockage or impaction. But he did emphasize that there is signs of the prostate enlargement, but he was like, but it's still the bones. You know, he's still focused on the bones. It wasn't it was something he glanced over and then went straight to the dangerous, devilish idea that we should feed our dogs bones and natural food, which most veterinarians have that indoctrination buried into their skull, or it's just because it's uncharted territory that they've never had the time to actually explore, because you know the universities aren't teaching it, and once they're out of the universities, it's bing bang boom, go into a clinic and work till your legs fall off. So it's more so aversion to things they're not aware of. But anyway, this happened on multiple occasions where the vet was solely pointing to the diet, and it was, as time has progressed, it has shown that it's never been the diet. So after this, we got the enema, passed stool, all is well, and then right after the enema, for a couple days after the enema, his stool turned from cylindrical to flattened stool. And that's a clear indication of a prostate enlargement, that where the prostate is pushing up now against the colon and narrowing the passage. So after a few days of that starting to develop, we went to a new vet to get a different perspective, and this is when I really was like, it's the prostate. But same thing, this vet said it's the diet, blah 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 blah. But right after, once we left, I brought him in, or he got like a rectal exam and things of that nature, and he went into a very like paralyzed state where he's in a lot of pain, hunching his back and moaning, and couldn't really exert himself. And it was right after that prostate or the rectal exam. But you know, she didn't feel like it was enlarged. I don't know how that didn't get picked up. But it's again another reason why you can't rely on these systems. They're just not. You need to become self-sufficient in being able to discern when is the right time to utilize Western medicine and modern practices versus when's the time to step farthest away from them, because they're very indoctrinated, and they can be very close-minded. So this was one of those times, and I didn't fully listen to my heart at the time, because I just continued on as if it will just heal itself, and it did not. It only progressed. And then, I don't know, maybe a week after this encounter, he could not urinate anymore. And that was really like the peak, or I should say the peak of the downfall. He couldn't get any urine out. So I brought him in again, got a catheter in him to empty his bladder. And then instantly the doctor's like, okay, we gotta neuter him. It's their go-to card for anything prostate related in dogs. Neuter, neuter, neuter. Which, especially in an infection scenario, does not make logical sense. And this is where logic and the scientific mind can clash together. I'm not a vet. I don't have a science background. I have a business degree, but I got a lot of experience in life, and I understand that I can see through the veil of it all, sort of thing. Like I understand, I've had enough experiences to connect the dots per se. I'm still learning, of course, but these systems that we think are all high and mighty, they're not really. They're really not. It's all simple at the end of the day. And that could hurt a lot of egos out there, of course, that have built their lives around money and status of their position, which plays into why you can't have a conversation about going against appealing to authority, essentially. So anyway, it's instantly neuters the resolution. Don't question it, just do it. Is the deal. That's how they go about it. And I was like, nah, I'm not gonna do it just yet. Took a day off, and then his bladder filled up again. So that's when and he was, that will kill anyone very quickly. So that's when I just, I at the time didn't have the knowledge that I have now. So I would have done it differently. But I did decide to get him neutered. Even against my will, I knew it wasn't the right thing, but I did. And after all of the experience, I can assure you that neutering did nothing for him. It did nothing for him. Neutering did not cure prostatitis at all. If anything, it hindered him, because this is where Western medicine and current veterinary practices become very cognitively dissonant. They do not consider any ramifications that occur once you remove the testicles from a dog. Like, they don't, it's not even a thought. It's just like, oh, it's normal. It's cool. Like, your dog will live on to be a happy old fella. Like, that's not the case. Like, once a dog has established his life with testicles and testosterone, it is just integrated much better into their life than a puppy, maybe like this little guy Benji. And he's got a lot more energy to heal from that. But you got a sick dog that has an infection already, and then you want to chop off his balls, which isn't the actual site of the infection, is quite honestly delusional in my opinion. But they have a scientific mind, and they connect, if you remove the testosterone, well then if you remove the testicles, you remove the testosterone, and then the testosterone will then create involution of the prostate and will then degrade. So they're treating it as if it's the enlargement of the prostate, which in actuality, it wasn't. The enlargement wasn't coming from a hormonal imbalance. It was coming from an infection. So that's for number one. I got him neutered and it didn't do anything. It didn't. Now, what I also learned is that in Europe, neutering and spaying is like, it's foreign to them. It's a very small niche. Not a lot of animals are spayed or neutered over there. And there's even countries where it's like illegal. I think there's like a collective of them. They have a name, I forget. But it's only really used in medical emergencies. Maybe this would have been considered one over there, but they actually have different access to different, or they have access to drugs that we don't have access to for our animals here. They're basically chemical castration drugs. I think it's called finasteride, that Europe uses all the time for dogs with prostate issues, benign hyperplasia, prostate hyperplasia. You can't get that, or no. I called around. No vets in the world over here know it. It's prescribed for men, but you could probably get it. You'd have to be digging, or you'd have to pull some strings with some people, but nonetheless, it's not a common practice. Europe, common practice, because they don't see neutering as like a go-to. They don't see it as the ultimate solution, where in America or the West, we see as surgery as like the best advancement of the modern world, which in some cases it is. You just got to know where to use it and where not to. So this is what I would say. If you're keeping your dog intact, recognize that the prostate for a male is keeping the possibility of certain things arising there in mind. It's not going to go away, the prostate is going to be a factor in the health of your dog. But you also need to just be aware of it, study it, know what it is. It's a donut basically shape around the urethra that that can easily cut off the flow of urine based on the placement. I think humans are the only other species that has this design where the prostate wraps all the way around the urethra. Cats have a partial wrap. It's not full, so they don't have as many prostate problems as dogs or humans. But nonetheless, we're not chopping men's balls off here. We're not. So why are we doing that to our dogs? Right? Just because they're animals doesn't mean we should be treating them much different than us. Don't get them neutered. I wouldn't say get them neutered. If your dog has an enlarged prostate, I would explore the chemical castration route, and there's a whole slew of holistic remedies that you could explore for it. I would not jump to getting them neutered. Especially if you have prostatitis. Do not, there's in my opinion, in my experience, no reason to get a dog neutered if they have prostatitis. No, I ended up having to catheterize my guy for 2 months straight, multiple times a day, because he couldn't urinate on his own. And I wasn't going to go into the vet all the time. But what I'm saying is that there is the opportunity to catheterize yourself. It's a very straightforward process. You can talk to your vet about it. They will help you get the catheters, the syringes, and all the sterile equipment. And it's a much more pleasant experience for your dog. Hopefully my guy was like super easy. And some dogs, they're gonna need to like get anesthesia for it, or they're gonna be not so relaxed, like not let you stick that in there. But if your dog is mellow, I would highly suggest, and you are in a prostatitis scenario where your dog can't urinate, I would highly suggest you being the one to catheterize, especially if this is going to be an ongoing thing. Yeah, it's a very straightforward process. So that would be another thing I would advise, that it's very possible to do it yourself. It's very simple. Another thing is, when you go into the vet, you should do your own research, because my vets, even though they were, in a nice clinic, well-renowned, yada, yada, I still had to bring information to the table that they were not engaging with me. So I had to ask for a urinalysis, which is like number one. You should probably do a urinalysis. Do all the diagnostics that you possibly can do to get a very clear idea of what's going on. Don't jump into cutting body parts off right away. Use all the diagnostics and use surgery as a last resort for these situations. Urinalysis is like number one in any urinary tract situation. Get a urinalysis. Ultrasound. What else? Blood tests, kidney panels, all that stuff. Anything to have to do with that tract there. Very highly recommended. It's a lot of money, but it's well worth the information. And then getting a urine culture if you do have an infection, to really analyze what bacteria is causing the infection, so you can do a antibiotic specific testing on it to see if it's going to resistant testing to see if it's going to be resistant or not, and narrowing down the actual antibiotic that could be used in this scenario. And dive deep into these antibiotics that they use, I mean, if you get to the point where you're in a similar situation, it could be, what I've learned is you might have to use it, even if you are against antibiotics, which I am, and I did not use the antibiotics to the degree I should have, but that's a story for another day. But the reality is that the antibiotics they're using, some of them are not that good for our pups, and they can come with a lot of side effects. So you just have to weigh your risk there. And I would say explore things outside the box, explore other routes. I'm not going to get into those details right now, but yeah, think holistically. So anyway, if you do have a dog that's intact, recognize the prostate is a very, very valuable and integral part in the whole system, especially learn how its positioning is integral in the functioning of passing stool and urine. And once one or any of those become obstructed, it can become a really big problem. So keeping the prostate in check, you can get yearly ultrasounds to see what the shape, how big or small it is, if it's normal or whatever, if there's any abscessing showing an infection or cancer or any of that nature. Those are things that I'm going to do now with Benji here, and keep an eye on his prostate, because we're not neutering him. There's no doubt we're gonna neuter him. Eat a clean, healthy diet. Fasting is really good to keep inflammation down in the body. So I would engage in ritualistic fasting. It's been used on men for prostate enlargement and has had quite good results, even though of course there's not that many studies out there because they don't want to be studying this stuff too much. But fasting is a very, very valid and interesting modality to add to a healthy life, humans and dogs, especially regarding the prostate and enlargement and inflammation and things of that nature. And keeping an eye on the urine flow. If that starts to come in spurts or trickles or no flow, then there's a sign that something might be wrong. And keep an eye on the stool. If it flattens, then you have a sign that the prostate might be enlarged or there's impactions. That is what I would say I have learned so far with dogs regarding prostate health. You could go deeper into it. I'm not going to do that right now. Vets could, go on for days, I'm sure, showing you all this clinical research and this and that. It's simple to me at the end of the day. I mean, a lot of these issues are probably arising, in my opinion, because dogs aren't able to mate freely like they normally do. And if they are, they're mating with unhealthy other dogs, and it creates this whole problem. But it's essentially a organ, or I guess you'd consider it an organ, right? Maybe not, it's not secreting. I don't know, but you essentially have a part of the body that's not being used. If a dog is not mating, his prostate is essentially being dormant. And when dormancy happens for an extended period of time within a dog's life, then it becomes frail, and it becomes weak, and it becomes, dysregulated from the rest of the body. So in my theory, a dog should be, of course, mating when it wants to, having free reign be out in nature and doing it whenever nature calls for it. And in the modern world, it's a much more unnatural way for our dogs to exist, which is hence why we might be experiencing more prostate issues than there wouldn't be any in nature. It's akin to me like the prostate issues that are seen amongst monks. Monks tend to have a lot of prostate issues from what I've read, and they practice celibacy. And it probably has to do a lot with age of when the dog is or isn't going to mate. So, in my opinion, I mean, the later you mate your dog in life, the more risk you run with the potential side effects, and know there could be side effects with mating. For a puppy or for a dog that doesn't mate, then there might be more ground to run on, especially if you get to a stage like you get to the 7 or 8 range and they haven't mated yet, then the risk is probably outweighing the reward or the possibility of nothing happening, and it might be better off to not mate them for the rest of their lives, but nonetheless to keep them intact and use chemical castration or other modalities if needed to reduce any sort of prostate enlargement, because a prostatitis situation or prostate infection is more or less going to occur, in my opinion, it's something foreign has to enter through the urethra. So it's not just going to happen out of nowhere, and the most common place I'd assume it happened is through mating. So hopefully this helps anyone out there that's got an intact doggo. And I'll just pick Benji up here, and we can say goodbye, and hope all the other doggies out there have some healthy prostates.